Hi, this is Stan Goff. I'm the managing editor for Dental Products Report and Dental Practice Management. And today we have two great guests. And I'll start by introducing Heather Colicchio. And Heather is the founder and the president of the American Association of Dental Office Management. And Heather is going to introduce our next wonderful guest who is quote unquote a rock star member and office manager. And she's going to explain what her practice is doing on a day-to-day perspective and how they're accommodating patients and how they're doing the best they can through this pandemic. So hi, Heather.
Hey, Stan, how are you?
Pretty good. So why don't you, Heather, tell us a little bit about you, and then you can go ahead and introduce Debbie.
Yep. So I'm the founder and president, as you said, of the American Association of Dental Office Management, better known as FAADOM. And we are the nation's largest professional organization for dental office managers and practice administrators and business leaders. And thank you for having me back, Stan. We've been super busy at FAADOM, helping get all of our members through COVID, through the pandemic, and being the best resource that we can as things continue to shift and change. And Stan, you invited me on today to talk about where the office managers are right now today in all of this. And I can give kind of a global view of what I observe, and that might be helpful, but what I think would be really so much more helpful is to get hear the story of a manager who's living it day to day in a practice with the dentists and the team and the patients. And that's why I invited Debbie on. Debbie, as you said, she's just a rock star. And a little bit about Debbie. She is the practice administrator and the vice president of Wainwright and Wassell in Raleigh, North Carolina. She's also a fellow of the American Association of Dental Office Management, and she's pursuing her mastership. She has been with her current practice 15 years, and she has been in dentistry for over 25 years. So, Debbie knows what's what. She is also the co-president of one of our largest chapters, the Triangle Area North Carolina chapter. And that chapter has won Chapter of the Year 2 years in a row now. No small feat. And Debbie's a perfect example of, as with anything in life, what you put in is what you get out. And she has given so much of herself to FAADOM and to her fellow members. And, I just hope it comes back to her. And she did a webcast for us early on. I think the thing with COVID, from what I saw, the practice managers, they're leaders. They're, leaders in the practice. And oftentimes that's not recognized the way it should be. But with the pandemic, I was just, so pleasantly, not surprised, but pleased to see our members step up into their leadership roles and really take charge of a situation where no one knew what to do. And they got in front of it and educated themselves, through FAADOM and through all the available channels. And I just saw such a tremendous take charge attitude of all of our members within their practice to say, we got this, and really get ahead of it and pivot as they needed. And Debbie was just such a great example. I mean, early on, she was so ahead of everything with what she was implementing in her practice, with her team, with her patients. So now that we've seen a reopening in dental practices across the country, I just thought she would be the perfect guest to talk about what she is doing in her practice on a daily basis and what that looks like, and what she can share as far as best practices to the other managers out there.
It's wonderful. So for those who aren't familiar, it's Debbie Evans, and she is going to now tell us a little bit what's the workday like post-COVID, and how have things changed in the practice?
Well, I'm going to preface that with one thing. I'm going to say thank you to Heather and FAADOM. We couldn't have done it without you. I mean, it's unbelievable, the resources you brought to us. I'm serious. They have over 10,000 members now, and on Facebook, and it's just, no one is joining it. If you haven't joined it, you need to. And also get involved in a local chapter, because it means everything, and it helps your career. You will skyrocket, I promise you. And also, thanks to my doctors. They were so excited that I was going to do this today. It's Dr. Matt Wassell and Dr. Mark Wainwright. There's 4 dentists here, and we have 25 staff members, so we're a large practice. You said, how has a workday changed? Well, it's changed a lot for the administrative, but I would say for the clinical, it really hasn't changed a whole lot except for the additional PPE that you use, and a few more little things we do. I'll go into that. But the administrative team is probably, their work is quadrupled because you have the wellness forms that have to be filled out, the curbside check-in, we're making sure that everything is done and complete before a patient comes in. And also, since they have so much more to do with phone calls, talking to the patients, checking in and all that, that we've implemented some, to take away from the workload, some things like insurance verifications, things like that. We use a company called ExtraDent to help with insurance verification, because before a patient comes in here, we make sure we know everything about their insurance. So, yeah.
So I imagine there had to be some steps that needed to be taken just to help with the efficiencies. Not that you weren't already working on those types of things, but there have been some challenges with this new, post-pandemic, and I imagine you guys have learned a few things that you could probably share with other practices.
Well, I do have a step-by-step plan that I came up with, and when I did an ADOM Live event, and it is on the ADOM Live COVID page. So if anybody go on there and right, Heather, you can go and just download it on there.
Yep, that's dentalmanagers.com/ADOM cares. So, and real quick, Debbie, just for everybody out there, it's a general practice, right?
No.
You're correct?
Yes, general practice.
Yep.
Yes.
General practice. And how long were you closed during COVID?
We were 7 weeks.
7 weeks, okay.
We were closed. I was here along with about 2 or 3 of my business staff, because the business still runs and you still have to make sure everything's running smoothly. And then with this pandemic, everything was new. I mean, you all know that. We had to come up with new strategies, how to reopen and make sure our patients were okay. We did emergencies only. So we always had a doctor on call and the phones were being answered. I have a few people that work from home too. So they reshuffled the schedule, because, 7 weeks of patient, especially with a big office like that, that's a couple thousand patients that we had to, work with. So it was fun. We did it, but all is well.
So one thing I want to ask, Debbie, that is coming up a lot, if you could talk to us in detail about what your check-in process looks like now. When a patient comes to the office, kind of walk us through what that procedure is.
Okay, so everybody's familiar with the wellness screenings that we have to do. So what we do is we have our phone system, it's called Weave, and it is like probably one of the best things we've ever gotten into. We send out via text to all our patients and email, we send out a wellness form. That's a couple weeks before their appointment, and then we send another one out about a week. And if they haven't come back within a day before, then we resend it out again and also email it to the patient again. And the next morning, all my business staff, there's 6 of them up front, and they're like in a circle. They all talk to each other, and we find out who hasn't had a wellness screen, and they call the person in that morning. Or when the patient comes in, we'll screen them then. But as always, people come in the parking lot, that's going to be the new waiting room, and they text or call us and say, I'm here. And then what happens from there is we get it, we said, okay, thank you. Then we have EagleSoft software, and you can just hit a light that says they're here, and that's what we do. And then that notifies the back, that's the assistant and the hygienist, that the patient's here. And if they're ready, they message back to them, I'm ready. So, and then the front desk will call or email the patient and said, well, come on in. So by the time they come in, the assistant, the clinical staff will be there by the door waiting for them. Then they have the temperature, they take their temperature, we do the hand sanitizer, but the patient does come in with a mask on or a face covering for sure. We make sure they do that. But they do the hand sanitizer, do their temperature. And I wanted to share this with somebody. This is something we started too after we opened. So, we do the temperatures, and we do temperatures of all the staff every single day. So I came up with this COVID daily screening log, okay? So in it, and it's done by the month. So in it is a daily screening log. The ADA has these right here, okay, ADA. And we just fill them out for every single employee. And then what I do is we keep a HIPAA compliant schedule out front by the door. And then they write down the temperature of the patient there. And then at the end of the day, I get it and I put it in with that day's all the temperatures are being taken. So we have a log, and if anybody comes in and asks anything, it's all right here in my log. I'm a stickler for things like this. So anyway, that's something that I thought was a good idea that we did.
That's a great idea. That's a fantastic idea. I have a quick. Oh, I'm sorry, go ahead.
No, I was just going to tell you another thing about keeping that schedule, but it's HIPAA compliant now, just in case somebody looks at it, they don't see, everybody's name, who's here. But anyway, if the hygienist or the assistant forgets their temperature, it's like, what was their temperature again? Well, they'll come up and look, and it's right there. So it keeps track of all that.
Gotcha.
Have you had an instance, Debbie, where a patient came in with fever and you've had to turn them away?
One time.
And they were okay with that?
Well, everybody's, we're like, we make sure they take their temperature before they come in. Do you have a cough? Have you been out of town? We ask all those questions. But anyway, so go back to when they come in, they to go in the back, and we do the hydrogen peroxide, 1.5% hydrogen. They do the swish for 60 seconds, and then business as usual. And then checkout is, we try to do touch-free, handless check. So if a patient doesn't have a balance, and they already have their appointments and everything, they just walk out the back door, or there's another door that they go out. Patients come in one door, and they have to go out another door.
Gotcha.
Now, if they have to check out, we found, this is a hint for people, we found that we do have the plexiglass screens in front of all of our business team. They do wear masks too, and the screen. So we find our patients are like leaning over the counter to talk to them around the plexiglass. So what we've had our clinical staff say, would you please stand? We have these stand here, these circles on the ground. Would you please stand here and, and go talk to them through the plexiglass? And everybody's been doing it since you point that out. And then they say, please, when you leave, just go around to the side door and please leave that way. You have to direct people because they're used to going and coming in one door.
I have kind of a two-pronged question. First off, it sounds as if the patients are returning, a lot of confidence coming through, the schedules are filling up. But backtracking to during the shutdown, what steps did you take in terms of communicating with the patients and the clinical staff and kind of preparing for the reopening?
We did a lot. Let's start with the staff. Zoom. We had Zoom meetings once a week. I also had one with the hygienist once a week. I had one with the assistants, and I had one with the business team. And then the doctors and I also had one. And then every 2 weeks, we had one with the whole team. So we open communication, and that's the way we are here. And I also asked everybody, because I've heard a lot of managers, and the scare was not having people come back to work. And that was a big thing. So all I did was I said, and it's really simple. What do you need to come back? And just please tell us. And our docs want our people to come back. And we're lucky. We got everything that they wanted to come back. So I feel like I am so lucky, and we're so lucky here that every single person came back to work. I mean, right. So we have 6 hygienists. They all came back. So their schedules have been full since then. And then with our patients, we constantly Facebook, Instagram, we sent out newsletters. We just let them know. And somebody was always here or at home, answered the phone at all times.
So now I imagine you were taking all kinds of steps to make the patients feel comfortable when they did return, but I'm sure there was a lot of communication with them as well to make them aware of such.
We sent out, as soon as we had a plan in place of what to do, we sent that out to our patients. We had a video like we were the patient, and this is what you're going to do for the check-in process. And we put that out to them. Also on our website, we put a COVID page, and then you just click on that, and it told what was going on with, like when we were going to open and what was going on. If you have an emergency, call this number. And since then, in fact, here's something new we're doing is we're working on a new COVID page. So you press it on the front, and then you just press it on the website, and it goes into a page. And it's almost done, so it's going to be out in the next week. We've done a little video with slides on exactly what a patient should do. It's real simple. Instead of watching like a 2-minute video, this is just a real quick what we do. And also, I've taken pictures. I went all around the office, and I took pictures of everything. So it shows our patients exactly what our office looks like and the steps we're taking to keep them safe. So I can't tell you how helpful that was. And then here's something else. We have flyers. You see that? And then right here, it says COVID-19, it says what we're doing, okay? And then on the back here, we can do this later, but a marketing thing. Well, what I've done is we've had so many Google reviews, more so than before we had a lot. And all of them are saying about how safe they felt.
Gotcha.
I can't tell you how wonderful that made us feel. I mean, I feel like, okay, we're doing something right, but you're never perfect. But, so that's that's a little tip for everybody. So.
Gotcha.
Well, Deb, you're doing a lot of things right. I mean, the fact that your entire team came back, you didn't lose one team member, and your Google reviews are so positive about the steps you've taken, not knowing going in whether they would be, right or wrong. So 2 thumbs up for you. I mean, you are a rock star. I knew that.
Yeah.
Oh, you just want everybody, you want your patients to feel comfortable and safe. And where it starts from? It starts from your staff. And if they feel safe and comfortable at work, they're happy and comfortable, then they're going to reflect that onto your patients. I'm all about a happy staff. So,
and that's kind of a nice transition to the whole topic of PPE. I mean, just maybe if you can explain a little bit about how the practice has gone about acquiring plenty of PPE, making the staff feel safe and comfortable, and have there been any issues in terms of charges to the patients and whatnot regards to PPE?
Well, we're lucky. We got everything we needed, but in just we just got little supplies of it. But since then, we've been getting everything we need. So like we have N95 masks. I have a bunch of those now. I have a KN95. I have level 3 mask. In fact, I have every color you want. I have those. I have, also we got antibacterial washable mask, and I've got one, but anyway, somewhere. But anyway, they usually put those over their N95 or the KN95 mask to protect them, and they're washable, so they can wash them every day. We've got washable surgical gowns. We have disposable surgical gowns, face shields. Of course, we have the gloves. So that's everything they need. I mean, for the clinical size. And now on my front desk, I told you each front desk person has a basket, and in it is our wipes, the mask, hand sanitizer, everything they need, plus the shields. Yeah. What else was that you were?
Patient response, patient charges, any issues at all like that?
Charges, yeah. We do charge for PPE, but we don't charge our patients. We do send it out to insurance, but we write it off because we do there are some insurances, and I do have a list of them that I know that pay for the extra PPE. It's United Concordia, Principal, Cigna, and Premier Blue Cross Blue Shield, and maybe a handful of other small companies do, but the larger companies seem like they're not going to do it. And it's a large expense for us, but we do not want to put that expense on our patients. We just don't do it.
Nice. And it sounds like there's been no pushback about wearing PPE, obviously from your team, or masks from your patients. Everyone's been on board.
Yeah. Now we had a couple people just, they're like, oh, no, and do I have to wear it? And we're like, according to the CDC, you need to wear the mask in here, and we would appreciate if you do. And that's all it takes. It's actually how you present it to them. It's not like you have to wear a mask or you can't come in. I mean, do it nicely.
Yeah, and I think anytime you mention CDC, that it's not you necessarily or your practice. It's those are the guidelines we all need to be following. So
they're there for a reason.
Yeah.
One of the things we talk about a lot of times with practice is morale, especially during troubling, difficult times. And you've kind of addressed it. It sounds like you got a pretty good staff there, and everything's going pretty well. But can you just touch a little bit about the overall morale?
Well, we had a staff meeting this week, and we went over different things with them, like positivity. How do you feel? And what can we do to make each other positive? Because I'm telling you, I feel it too, and I know everybody feels it. There's a COVID black cloud over us. I mean, everybody feels it. It's like, okay, when is this going to end? It's like, what can I look forward to? But we try to keep doing things as normal. So you keep it as normal as you can be, your day-to-day lives here. I mean, we celebrate my doctors get kind of upset because we celebrate everything, but you know what? It's okay. We celebrate birthdays, anniversaries, babies, you name it, we do it. So they just keep positive.
What does it look like, Debbie? I mean, I don't know if pre-COVID you were doing daily morning huddles, and if so, are you able to continue that practice?
We still do. Yeah, we do that. We happen to buy the office next door, so we're lucky that we have a bigger room we can go into. So, because there's 25 of us, and we all get in there, but we wear our mask together. I'm surprised everybody wears their mask, but we all, wear masks at all times. Now, when I'm in my office, I'm not wearing a mask, but as soon as I step foot out of my office, I wear a mask. We do that. Our patients notice that. I mean, you notice if somebody's walking around without a mask, I mean, people feel funny. So we make sure we have our mask on at all times.
You want them to feel safe, and it seems as if with crowded, room, you're booking the patients. It sounds like you're doing a good job with having the patients feel comfortable and confident to come to your practice.
Well, that's what it's all about. I mean, it's all about the patient. It's all about the patient.
I just want to circle back real quick to marketing, right? So during COVID, that was probably the last thing on anyone's mind. Everyone's just trying to keep their head above water, but you're ahead of it. So talk to us about marketing and what that looks like now and what you're doing differently.
Okay, so as I said, keep doing what you're doing. Make it as just normal. Okay, the same thing. We put Facebook post out. But like I said, we celebrate birthdays. We put everything on Facebook and Instagram, everything. I mean, you name it, we do it because we have a pretty good following. So we try to do funny things. We try to celebrate. We even put our reviews on there to make, and then protocols of what we're doing. You can't just do it once. Like this is what our office is doing for protocols for COVID. We do that occasionally. We add stuff in. Hey, we're doing a couple of new things too. Let me find my little page on that. Anyway, we've got a new thing that we're doing to the office. It's called BioPure, and they come in and they spray your office. It's every 30 days, and then they put a shield down. And I'm telling you what, we videotaped them and we put it on our Facebook page because we thought that would be great to show. And our patients love it. And I actually watched it, and I was here with them, and it was amazing. And it's supposed to last 30 days, and then afterwards they can come back and redo it. So we do this office, and we also do the other office that we have our meetings in. So we do that once a month. We also got air purifiers with a HEPA filter. We did that. We couldn't get it before we opened, but we have got that since. And also we have these UV lights that we turn on, and in some of the rooms, and that it goes on between 30 minutes and 30 to 60 minutes, and it kills all the bacteria in the room. So, but that's what we do, which I think is kind of neat. We also, I told you we send these out, same thing, and I already said that about the COVID and all that. So I think that's a great thing. Okay, anything else?
Debbie,
I'm sorry, I was going to say, it sounds like you're sharing a lot of great tips for from other practices, but I was going to also ask Heather to maybe share a little bit of advice as how other practices can maybe get some of the education and resources that they need, and some of which maybe they would ordinarily get, in-person meetings where now those are kind of on hold.
Yep, absolutely. So if you're not a member of FAADOM, I encourage you to join at dentalmanagers.com. And even if you're not a member, we do have our FAADOM Cares page, which is all of our COVID resources where we are continuing to add just to get information out to the dental community. That's dentalmanagers.com/FAADOM Cares. So that's a great place to start. If you are a member, because we can't all meet physically as much as we'd like to, I would encourage you to spend more time on our Dental Management Excellence Facebook page. That has really blown up the past few months, and you can request to join it as a private page. And if you are not a member of your local chapter, check that out. We have 75 chapters across the country. Some are meeting in person in small groups, and some are hosting their meetings virtually, but it's a great way to connect locally and find out what other practices are doing in your area. Yeah, Debbie?
Yeah, our chapter, we have 145 members, so we're probably the largest chapter you have. Yeah. And we can't have meetings, of course, but we've been doing Zoom meetings. And I'm trying to get some really good speakers, and then we give out prizes still. So we try to make it like the same feel as you have if you're in a meeting, but we're doing it on Zoom. There's another one coming October 1st too. So anyway, but go to FAADOM's site. It has helped me. I still go on the FAADOM Cares page and download things. I mean, really. And I'm a junkie for learning. I don't think you can ever think you know everything. You can keep on learning. FAADOM does that for me personally.
Well, the last thing I want to add is our fall semester. So our annual conference was scheduled for September in Boca Raton, Florida, we've obviously had to cancel, but we have developed a complete semester full of education for our members. So it has not launched yet. If you want to be the first to find out information about that, it's dentalmanagers.com/fall semester. And I also just want to let everyone know that although we are not having our conference in person this year, we are planning to do all of the amazing things we do at conference virtually. That includes our Chapter of the Year award ceremony, and that includes inducting our fellows and our first class of mastership members, of which Debbie is in the inaugural class. So we'll be getting all that out to everyone to keep the spirit alive, and you can check back on our site or at the fall semester page to see our calendar of events. We have things lined up through September and October to keep the community strong and keep everyone connected.
Yeah, I kind of want to second what Debbie and Heather have both said. It's these have been difficult, trying times this year, an unusual year, but there's a lot of good information, a lot of good resources, and I just think sharing, from practice to practice and experiences and offering up tips, and it just helps everyone out there, and the industry as a whole just benefits.
Agreed.
So I think we've covered a lot of good stuff here today, and I want to thank you both for coming on. And again, check out the websites, and just keep doing great things.
Thank you so much.
Thank you both so much for coming today.